my presentation is going to be focused on just training peer workers in mental and behavioral health. So kind of focusing more on my team's efforts to develop a measure of peer support. Yes, my name is Toby, and I am currently in training, getting my MD and MPH at the same time. So just so you guys have a brief overview of the content of this presentation, I'm going to give a brief historical overview of peer support, kind of its origins, how it came about. And then we'll talk a little bit about the current standards for peer support as per SAMHSA and the standards that they've posted on their website. And then I'm also going to talk about some of the strategies that we developed or discussed when coming up with this evaluation tool and this whole process, and then our methodology, and then some of the concluding points that we've had. And like she said, if you have any questions for me, I will have a lot of time, I'm sure, for questions at the end. So please feel free to ask any of those questions. So peer support is somewhat of a novel topic, right? There have always been people kind of since the 1800s who've been advocating for mental health and have been advocating for more peer structured interventions. But the birth of the peer support movement in the United States kind of finds its home in the late 1960s, early 1970s. It was part of what we know as the civil rights movement. During that time, there were lots of human rights focused efforts. So it wasn't just civil rights and fighting for an end to racism, more structural, obvious racism. It was also people fighting for disability rights, mental health rights, sexuality and orientation rights. All of these things were kind of encompassed into the civil rights movement. So specifically as it pertains to peer support, in the early 1970s, there were groups of people who had been previously institutionalized, which is how they referred to it, in psychiatric hospitals, who just were completely subjected to a number of inhumane treatments and therapies, forced to take medications to induce comas for extended periods of time, shock therapy, things of that nature, that they just did not find appropriate. And so they kind of formed together to form this anti-psychiatry group in order to empower other people whom they'd called survivors of psychiatric interventions. And their main goal was to kind of offer an alternative way for supporting people who were struggling with mental and behavioral health issues. And this is including substance abuse and things of that nature. At that time, it was basically anything that would have had you institutionalized in a psychiatric hospital. So one of the people that a lot of people refer to as the founder of this movement is Howie the Harp, or his full name is actually Howie Geld. I'm actually not sure how it's pronounced. He unfortunately passed away in 1995, but a lot of people refer to him as the originator of what they called the ex-patients movement. One of the first groups that kind of came about as a result of the civil rights activism was the Insane Liberation Front. That's what they called themselves. But it only lasted about 6 months. And so Howie is actually originally from New York, and that group started in Portland, Oregon. So after those 6 months kind of came to an end, he left Portland to go back to New York, where he then founded the Mental Patients Liberation Project in 1971. And I'm not sure how many of you might be familiar with this, but there are now a number of organizations all across the United States that kind of honor his memory and kind of honor him for being kind of a pioneer in terms of peer support work. And his story was basically that he was hospitalized after a suicide attempt at age 14, and he was there for over a year, and he felt as though he was tortured in a number of different ways. And so after he was discharged from the hospital, he kind of dedicated himself to a lifetime of advocacy for the mentally ill. So he was definitely a very strong and courageous person. He did a lot for not just people like himself, but people who kind of shared a similar story, who've had similar experiences, and people who'd not yet kind of experienced hospitalization, but kind of working to kind of prevent that. So he did a lot of what we now refer to as peer support work, which is why he's known as a pioneer in this area. And Judy Chamberlain, she's another person who is also equally passionate about peer support work. And she actually wrote a book that was called On Our Own: Patient-Controlled Alternatives to the Mental Health System in 1978. And when it was published, it completely changed the game. Like, it completely changed the landscape. Not only were people who had previously been institutionalized themselves kind of empowered and encouraged by her words, but she also was able to hit like the psychiatry, like the medical side of things, as well as psychologists. Like, she was able to deeply penetrate the mental health system in terms of kind of revolutionizing their thought as to how they treated patients, how they treat one another, and kind of, I guess, starting those early conversations on destigmatizing mental health struggles. Like Hallie, Judy was hospitalized after a severe suicide attempt. And she kind of has told many stories publicly of how she wasn't quite sure what on earth was going on when she was hospitalized. At first, she thought that she was having a seizure or something because they were telling her that they were going to give her seizure medications. Then they just kept taking her from room to room to room until she was ultimately diagnosed with schizophrenia. And at that point is when they started injecting her with high levels of insulin, which was meant to induce a coma. And so she was kind of subjected to a wide variety of torture, medication torture, if you will. And this is part of the reason why she felt the need to share her perspective in the text. Again, it's a patient's point of view on the entire system. And it was a very powerful text. And so some people call it like the manifesto of peer support work, because it kind of outlines what it means to be supportive of one another when you have like a shared lived experience, especially as it relates to mental behavioral health problems as well as substance use. So, with that history, with that background, with that context, you might be sitting, or you might not be, but you could be sitting here thinking, like, what is peer support? So the one thing that peer support is known for is this peerness. That's like a term that has been coined by the movement. And so peerness is essentially meant to encapsulate what it means to share a common lived experience. Like, if I have personally struggled with depression and have had very deep, dark thoughts, I can also find someone else who's been where I've been. And we can relate on that level because of our shared lived experience. And that's kind of where peer support kind of embodies the interpersonal connection. Because of our shared lived experiences, we're able to connect on a deeper, more intimate level that perhaps you wouldn't be able to connect with maybe a regular counselor, should that be the case, or your siblings, your family, the people that you might not have selected in life. Peer support also includes like recovery advocacy. And so part of the point of peer support isn't just to keep you comfortable in a down state, right? It's meant to kind of uplift you and encourage you to kind of get back on your feet in a place where you feel much more comfortable being you, much more comfortable in the skin that you're in, knowing that you have the power and the ability to overcome what it is that was keeping you down. And so your peer support worker, or the person who's offering you peer support, is there to advocate for you, not just to like larger systems, but to advocate to you. Sometimes it's hard to believe that we're actually capable of what it is that we're capable of. And so that's another beautiful thing about peer support, and that kind of lends itself to self-empowerment. It's very important that we all feel that we can have a firm grasp on ourselves, right? A firm grasp on our futures, like we have some sense of control. And part of peer support work is to empower one another, not just myself as perhaps a peer support worker, but as you as the person that I'm talking with, so that we can both be in this place helping one another. And so from all of this, you find community. It's your group of people. It's the people who've been there supporting you. It's your chosen family, right? Like the people that you get to do life with, because there's just so much intimate connection within peer support. And so in more or less terms, if you ask me, that is what peer support is. And these 5 phrases actually align with SAMHSA's published definition of peer support as well. So you might be thinking like, well, if peer support is this wonderful thing and it was bred from such a beautiful movement, what's the point of evaluating it? And I think that when we kind of look at the term evaluation from a more objective standpoint, sometimes it seems as though there's like more cons than there are pros to it. But I can tell you that part of the reason why there's a need to evaluate it is because while everyone who considers themselves a peer support worker and is working in those spaces, not everyone has the same story. You have shared lived experiences. You might have struggled with a lot of the same things, but the story and life happenstances just aren't uniform. In addition to this, evaluation will allow for all those involved in the mental health system. So this includes peer support workers, psychiatrists, psychologists, social workers, caseworkers, organizations, and everyone else who considers themselves to be part of this system to have an actual, like, better, more concrete understanding of what the interventions entail and how they're working. Are they actually like achieving our goal of reducing/controlling mental illness and increasing hope and change? Or is this just not doing what we thought it was doing and it's just creating another space for people to kind of fall down a darker hole, right? And thirdly, it actually allows us to kind of establish uniform expectations of peer support work. Coming into a space where I've just described the definition of peer support, so I'm coming in with those expectations, but if I go one place and those expectations aren't being met, and then another place where those expectations are being exceeded, it's as though, you know, there's like a lot of trial and error in terms of finding that space that fits. And while that's naturally okay, it would be better if we could all have kind of uniform expectations and everyone performing at a baseline. And exceeding those expectations would always be amazing, but having like a baseline kind of allows us to advocate for more funding, right? More contributions on a federal level in terms of advocacy work. So the current standards that exist for peer support work, it does vary by state right now. But these are, again, the standards that have been published by SAMHSA. So I'm from Texas, I'm in Texas. So this slide is really catered to what I know and see here in Texas, but it does vary by state. And actually in California, they have subjected the standards for peer support to each organization. So they don't have like a statewide standard for peer support, it's per organization. Whereas in the state of Texas, it's very clearly delineated what is expected for someone who desires to engage in peer support work. But universally, the expectation is that there's a shared lived experience. They don't necessarily want allies, right, coming into peer support spaces to kind of do this work. And the reason being that allyship is incredibly important. It's important for kind of sustaining community outside of just people who share those same lived experiences. But when you haven't walked the walk or talk the talk, it's much more difficult to genuinely empathize with and empower someone else who has gone through the things that you've gone through. And so the shared lived experience is a pivotal point of peer support, especially as it relates to mental health and behavioral health and recovery. So another important thing, and this is particularly true in the state of Texas, is that you have to be able and willing to discuss your personal recovery story. Texas is just really hard bent on people being vulnerable in that way because the state believes that kind of this level of vulnerability will help to advance the mission of peer support, as well as honor the memories of Howie the Heart. And more universal standards are this expectation of mentorship, advocacy, and recovery support. So mentorship can come in a variety of forms. It could come from leaders of organizations. It could come from the peer support workers themselves. It can come from peer-to-peer work. It could come from physician-patient relationships. It could come with psychiatrist-patient relationships. It's multi-tiered, but it's still like a universal standard that exists for peer support work. In addition to advocacy, everyone knows that the road to recovery is not easy. You will fall, and it's important that you get back up again. And so advocating for one another in this deep, intentional way, knowing that you've kind of been there, is an important and essential part of peer support as well. And so that includes the recovery support, kind of getting people to places where they feel that they have the opportunity to get back on their feet, getting people to places where they feel that they can be all that they desire to be and more. And so these standards are kind of held and maintained in a variety of settings. So this includes peer-led organizations, shelters, recovery homes, places like SHARE, places like Alcoholics Anonymous, like all of these spaces kind of encompass what we know as peer support. So, oh, sorry, excuse me. So here we have like our evaluation strategies. So part of what we wanted to evaluate with the peer support was self-efficacy, the validity of peer support interventions, as well as job satisfaction. So we focused our initiative on kind of assessing peer support workers' responses to scenarios that examined self-efficacy, job satisfaction, and kind of furthered the mission of validating peer support interventions. At the end of the day, I think part of our larger goal is to advance the mission of peer support work, as well as acquire more buy-in. We want more people invested in this. We want more people to put their money where their mouth is, especially as it relates to mental and behavioral health interventions, because it's important. And research and studies have shown how effective peer support interventions can actually be, the difference that having a peer support worker makes in the lives of people. It's incredible. And, you know, it's so much so that it has now moved beyond just the realm of peer support work, right? Like there's of mental and behavioral health. It has expanded beyond that realm to other realms that include a wide variety of things like grief, right? Everyone has heard of it in terms of like grief counseling, kind of been there, done that. Everyone experiences death, and just a variety of things like that. So basically what we did is we gathered about 270 people, and we kind of did the interview with them. So I see kind of some familiar faces on here. But we had these interviews with some people who worked at SHARE, where we asked you a variety of questions on some like cases, and we asked you to respond to the best of your ability to those cases. And what we've done with that information is we've had some raters kind of go back through the interviews, listen to them, and score them. So it's basically like a pre and post test analysis, evaluating basically peer support worker training, right? That's essentially what we're focusing on. And so we had people listen to the interviews, score them, and then we didn't just take one person's score and run with it. We had at least 2 people scoring each interview, and then had group discussions based on those scores. And so we have gone through the interviews before the actual training that SHARE put together, and now we're working on the interviews after the fact to see how or if your answers changed at all. And so some of the conclusions that we've reached or that we're reaching with this evaluation tool is that you know, we can actually see some of the important things that are coming from peer work contribution. We see the passion and the level of care that that the people that we worked with have for kind of supporting and uplifting one another. We've seen like improvements in self-efficacy. We see trends in job satisfaction, and we ultimately think that this evaluation toolkit will help to improve peer support worker training such that peer support is there's like a uniform and even standard across the country for peer support, that the expectations are uniform as well, and that they can only be exceeded from that point on. But it will always involve peer-to-peer interventions, working with one another, kind of getting down to each other's levels so that you can actually make a difference in each other's lives. But that's all for my presentation. It might have been very fast, but I thank you all so much for listening. I am open for questions if you have any. This is my email down here if anyone would like to contact me for more information. Thank you.
Thank you so much. Can you put the slide up with your email again, please?
Yes, absolutely. 1 second. Let me do that for you. All right, it is here.
We also had another question in the chat. Somebody asked how, I guess, if they can access this PowerPoint. Oh, you're muted, Toby. It's up there at the top somewhere.
Yeah, sorry. Yes,
Okay.
sure, I can share it.
Okay, awesome. How should I guess maybe they should share their email in the chat?
Yeah.
I suppose.
Giselle, do you have a question?
I do. So when you talk about these strategies to evaluate the peer work, and you're talking about like, well, all of them, but specifically job satisfaction, are you talking about the peer, the consumer, or are you talking about the peer worker, or are you talking about both?
Yeah, that's a really good question. I think that in this evaluation metric, we were mostly looking at it from the peer support workers' perspective. But that is a good question. It would have been good to look at it from both sides. But we were specifically looking at like peer support workers, and not necessarily specific to their organization, but kind of things that they would have felt would be necessary to kind of be in a peer environment.
So, but the self-efficacy and the validity of peer support interventions, those are more evaluated on the client side, on the consumer side?
No, all of our evaluation was on the peer support worker side.
I see.
So
Got it. Okay.
Yeah, we only, yeah.
So you're evaluating, so you're not really evaluating the effect that the peer worker has on the consumer. You're more evaluating the effect of the training on the peer worker and how the training has affected their work.
So the effect on the consumer is like a secondary effect, right? Like, because we are asking you questions on basically like, oh, what would you do if somebody, I don't know, kicked a shovel in front of you and injured someone unintentionally? Like, what would you do as a peer support worker? Those are the kinds of things that we are asking, and that's kind of helping us to understand how you've been trained to respond to that, in addition to the effect that it would have on the client.
Got it. Thank you. That's very helpful.
Thank you. Guess Andy.
Hello, thanks for the presentation. This is great. Kind of following up on the last, sorry, I'm in my van. Following up on the last question, do you have or have you done research into, I guess, both the effect of peer support work on the peer supporter, and then on that client side? I'm just interested to, dive into that, see if there are what the results there are, if those exist, or is that kind of outside the scope?
So that's a really good question. That's not within this evaluation per se. So that's not something that we would like necessarily publish, but have I personally? Absolutely. And the thing is that peer support has had a profound impact on like mental health movements, mental health promotion, mental health advocacy. And it has made like a tremendous impact. And so when you ask like about how it's affected the peer support worker themselves, that's also a really good question. And there are now like emerging studies on that. I can share some papers with you that I've just recently encountered. But there's a lot of discussion on how it's not necessarily easy to kind of be in this space, right? Advocating constantly still on your own recovery path, and then like helping others on that path. And then the consumer perspective, there's a lot more data on that.
Got it. Yeah, I'm sure your bibliography is probably rife with gems. Love to see it.
Yeah, sure. Thank you. Christopher?
Yes, where I work, we're starting to have issues. How do I put this? This is tricky even to put it, but peers that are of a certain age are starting to really be problematic with our LGBTQ community that's coming in, and we're having a great deal of people that are coming in. They're transgender, and we're kind of, I wouldn't say we're in a crisis, but I'd say we're getting to something that I'm not completely sure training is going to fix. We're going to try to do that. We're going to, because of where I am at, it's Spanish speaking a great deal more. I would call it hybrid speaking, where it's both Spanish and English. And we are going to try to get some people from, there's a satellite to the LGBTQ center that is in the area we are, but we're hitting a really strange situation where I hesitate to say this, but that potentially we have some peers that maybe need to be put to pasture. They're using their age as an excuse to basically not be person, based when they're dealing with clients or people that are coming in. And I'm wondering if you're seeing that, because this is very new to me. I mean, I'm actually a new peer. I've only been doing it for a year and a half, but it's starting to become not great. I mean, for me, I even needed to get backup where we finally had, we had a worker come in that was much more connected to those concerns and stuff. But there's been a great deal of, well, there's a cultural issue. There's also an age issue, which I can understand dealing with that, the people coming in. But when we're dealing with peers, it feels to me like that shouldn't be, an acceptable circumstance. And we do have training. I mean, like, because I actually have done the training and stuff for the people that are peers. And we do, and it's become much more about pronouns being important, about the transgender community, LGBTQ in general. But what I can tell you is it's just like going through one ear and out the other. There's even, I've even seen things so disrespectful to the point of where someone comes in very vulnerable and says that their pronouns are they, and the person will be like thou, thee, thy, whatever. Which to me is, is not cool, especially as myself being a queer person. I find this to be a real issue, and I'm starting to wonder if this is something that has to be considered, which is that not all peers necessarily can evolve.
Yeah, and thank you so much for sharing that. It's definitely an interesting thing to be seeing. And I don't formally work in a peer support space as I'm still a student, but I have seen informally through a lot of our interviews kind of some of what you're saying. We didn't formally assess, a scenario with this specific context, but we were working with a lot of peer support workers who work in a variety of settings. And so the point that you bring up is an important one, and it's also a good one. The idea that perhaps training isn't enough to kind of help people adjust to what it means to actually support one another. And our hope and intention isn't to reduce the number of peer support workers, but to adequately prepare someone for the workforce, right? To actually be able to handle what it is and to deliver good assistance. And so, yeah, I'm really sorry that this is kind of what you're experiencing, and I'm hoping that in some way, more rigorous, if you will, training can actually help to make that adjustment. And I know that in some states, like it's a requirement for you to complete, not just complete, but to do well, if you will, in your training before you're able to enter the workforce. So perhaps retraining could help. I'd hate to say that they should be entirely removed, but that is definitely a realistic thing that we might have to look at in the future. Thanks for that question. Are there any other questions?
You have a question in the chat. Somebody asked, did you use validated measures to assess things like self-efficacy and job satisfaction? And if so, which measures?
So this is more of like a qualitative evaluation. Was the questionnaire informed by validated measures? Yes. I'd have to do some digging to like provide you with that. But because we kind of devised the interview questions on our own, and this is kind of a novel thing, not many people have evaluated peer support worker training. There isn't much like concrete, textbook validated processes for how we're doing this. But the pre-post style of interview, the qualitative data collection, this is like validated and has kind of stood the test of time, if that answers your question.
Darren, I was just about to get to your question in the chat, but if you want to go ahead and maybe add to it.
Yeah. Two things before I get to you, Toby. I just wanted to really support the person who was speaking about, the lack of understanding and just for people and the importance for us in Australia. I've seen a real shift with new young people. Like I've been doing peer work for 20 years, and I'm really inspired by the new younger people coming through and their fabulous diversity, bringing diversity into peer workspace. So I think it's getting better. That would have been my message there in Australia. So yeah, I really support what was being said there, and I think people need the older people like myself who've been around for 20 years. You need to continually reinvent yourself and question yourself. But a question for Toby, our presenter. You've done the evaluation. Will there be a report coming out?
Absolutely. It's
Lovely.
taking a long time, but there will definitely be a report that comes out from kind of what we've seen.
And well done, because evaluations, they're a big piece of work to do. So I'd be very interested in getting the report eventually.
Yes, thank you so much.
Toby, I think you had another question in the chat, Laura, which I saw your hand up, Laura, earlier. Sorry, I missed you. Laura asked, would you be able to share findings from research that looked at evaluating the effectiveness of peer support interventions from the viewpoint of service users and or services?
Absolutely. I can definitely do that. So I will actually share the SAMHSA link where they kind of define peer support, because they have all their resources at the bottom. They even have some quotes, and then they have like a graphic on how effective peer support work has been from a research perspective. So as soon as I stop sharing my screen, I'll go ahead and pop that link in the chat.
That's great. Thank you very much, Toby. It was a very interesting presentation. I suppose the other thing I wanted to ask is where is the link? Or sort of, I can't quite link the work that you've done on evaluation of self-efficacy and sort of sort of you're looking at items that really have to do with peers and how, job satisfaction, etc. How I can't find a step between linking that very interesting type of data with the data of this is an effective intervention, or with the kind of us fighting the corner in terms of creating posts for peer support workers. Say in England within the NHS, they just want evidence-based. So if we say, well, our peers are sort of feeling better, they're staying better when they work as peer support workers, and this, can you help me with the next step with a kind of, and that's why we want to create more posts, or we want peers to have higher bands, or I can't quite make that link. Sorry.
Yeah, absolutely. That's 100% fair. So let me take a few steps back. This evaluation was specifically looking at peer workers' responses to a variety of situational scenarios.
Yeah.
And so we tried our best. It's only 7 questions. So we tried our best to capture a variety of situations that were realistic, right? So like an example would be, let's say you have some clientele coming to your place of work and they have spread a rumor on the street that it's okay for you to do drugs in your place of work. How would you as a peer support worker respond to that? So it's those types of things that we're evaluating. And, the final question kind of looks a little bit more at job satisfaction in terms of really understanding what peer support workers believe a peer support space is supposed to be. And so we felt that this evaluation of peer support responses, how they intend to induce and create more self-efficacy, as well as their perspective on the work environment, would be important in order to further advocate for the need for continued peer support, as well as like a concrete and solid investment into the training of peer support workers because of the impact that it could have on the client. So, in the pre-survey, you might have some really excellent responses that would suggest that it would have a very positive impact based off of research alone. How we kind of grade our responses, the quality of responses, more evidence-based. And so we might have some peer support workers who were kind of answering in a very excellent way that would advance the mission of peer support, whereas some people might say, like, for example, oh, I would defer to my boss, right? That's not really advancing the mission of peer support, seeing as you're the peer support worker. Does that make sense?
Yeah, yes, thank you.
Did I answer your question as well?
You did. Thank you so much, Toby.
Thank you.
Darren, do you have another question?
Yeah, I'll let others speak first, Jessica. I'm just wondering how much longer do we have in this session?
We have
we've got a lot of time. Yep.
Yeah, we about half an hour.
Excellent. So
Yeah.
I prefer to let other people speak before me. Thank you.
No problem. Okay. Marcellus, you have your hand up.
Yes, good morning. Thank you so much, Toby, for this amazing presentation. So with all this said about training peer support workers, I know you mentioned in your presentation the goal is to train peer support workers, PSWs, ready for the workforce and provide those peer support services. So, for example, I'm over in California, you all are in Texas. So depending on the state, there's also going to be 10 different types of training programs for them to go through a peer support training program to be certified. So I'm just curious for over there in Texas, is there recommended training programs or a specific kind of pipeline of CBOs or health facilities or any other vendors or employers these peer support workers are going through those training programs and going into those kind of employment providers?
Yeah, excellent question. So Texas, like I mentioned, has a very regimented system. They have it very clearly delineated how one can begin the process and how one is to end the process. And so there are, I want to say 30 to 40 required courses that a person has to complete before beginning peer support work. And Texas, to my understanding, has 3 places where you can obtain those trainings. And unfortunately, Texas is one of those states where the person who's interested in completing peer support work training and kind of entering the workforce carries the burden of paying for the training courses. And so there are 3 places that you can go. And I know that Texas, like Health and Human Services, is one of those places that you can go to get these mandatory trainings. Does that answer your question?
Yes, thank you so much. Yeah, again, really appreciate your presentation here.
Thank you.
I don't know if there's any more questions in the chat. So Darren, if you want to go ahead.
I'm sure other people have got questions. Maybe not. Maybe I'll just talk. Hey, Toby, just brilliant presentation. I really enjoyed that. Thank you. And it's just so lovely to link up with people from overseas. It is 2 a.m. here in the morning, so it comes at a bit of a price, but I just really love these international chats, and it's also a good chance to share maybe as well that because I'll put in the chat there in Australia, and I was wondering if it happens also in your I nearly used some Australian slang there, your neck of the woods, but I don't know whether that makes any sense to you or not. But in your area, so we're tending to lean towards using lived experience workforce as like an umbrella term for, because some people are doing lived experience research, some people are doing lived experience peer work. Is that the same for where you are, Toby?
So thank you, first of all, for joining in on this conversation at 2 a.m. in the morning. I mean, that is impressive, honestly.
No, I'm totally bonkers. Yeah, no.
So from my understanding, I really have the best understanding from a literature perspective. And so a lot of what I'm seeing is still the peer support worker. A peer support worker could be encompassed in a variety of different things. Some people, based on their organization, just refer to themselves differently. But in terms of just like, I guess, a national identity is still just peer support. I haven't noticed myself many like changes in how it's referred to, but perhaps someone else can speak to that better.
And just to follow up, there's no judgment on that. It's just that I put the link for the work that we've done in Australia just to share terms and just so that we can, all decide eventually what the best terms are. Thank you.
Thank you for sharing that.
I think Darren might have been the last question.
Okay.
If anyone, oh, okay, Toby's information is still on the slide. Good. So we still have some time if anyone has any other questions. If anyone wants to share information in the chat, you're more than welcome. Again, if you want a certificate for this, you can put your name and your email in the chat. I see everyone's information in there, so thank you for putting that in there. And also, very awesome presentation, Toby. You do very interesting work. I'm from Texas, so it's really, but I live in California, so it's really interesting to hear some of the peer support differences. You know, I had a really hard time finding a job in Texas, and so in fact I moved to California to kind of explore employment in a field that, you know, I would be passionate about and would love. And I'm from Austin specifically, so
Oh, nice.
I had a hard time. So this is really good to hear, though, because you know, one day I do plan on going back to Texas, and I love the work that we all do, and it's really good work. So it's good to hear that peer services is important in Texas. So that's awesome. Thank you for sharing that.
Well, thank you so much for having me. Thank you all for listening.
Okay.
I do appreciate it.
I've got one more question. I won't let you off the hook that early, Toby. We're gonna pick your brain, mate. It's I'm just wondering how because in Australia we there's, how can I say it? There is a tension between clinical staff, and when our peer workers are working with clinical staff and seen as much lesser than clinical staff. And I'm just wondering how it's going, and maybe it's a bit off topic, sorry, but I'm just interested in your thoughts on how you're engaging with clinical staff, and whether you're gaining respect from them as being effective workers.
Yeah, Darren, again, thank you. That's a really good question. And I would actually approach this question from the perspective of a clinician, because that's the field that I'm entering. You know, I wouldn't be a peer support worker because I'm training to be a physician and to be a psychiatrist specifically. And one thing I could say is I definitely believe you that there's that tension. I've seen it, I've heard it. You know, and it's a very real thing, but I think that some models of integration are kind of entering the medical school as well as public health systems, those spaces where they're training students. And so, you know, I've learned a lot about working on an interprofessional team, right? Working on like teams where there are multiple people who are serving the patient's needs or serving that person's needs. And so from my perspective, I think that everyone kind of has their role to play in someone's care, right? I'm personally of a biased opinion that peer support plays a very large role in terms of helping this person kind of adjust to a newer reality and kind of helping them walk out recovery, however that may look for that person. But I think that kind of some things that are emerging in the literature are kind of, and this is not the best way to phrase it, but kind of knowing your place for each person that kind of plays a role in the team. And so with the tension and sometimes the difficulty that comes with working with clinicians as a peer support worker, I think that an important thing to do is to re-emphasize kind of like scope of practice, right? Like, you know your role, you know why you're here, you know why you're working in this space, and it's important that you're able to carry out your duties as you've expected to do so. Now, some places kind of have a lot more freedom in terms of how they allow everyone to practice, but because of the importance of peer support work and the like case-based evidence that has come from this type of work, is important that, you know, you feel that you can advocate for the work that you do in that space. And the dismissal of peer support as lesser is disheartening to hear, right? Because at the end of the day, peer support workers are the people who walk you through your entire journey. Clinicians and other members of the team might do 3-month check-ins, but your peer support worker and the person who's been here with you since day one is the person who's with you on a daily basis. So while I can't offer the perspective of actually being on the ground, I would like to offer some encouragement and perhaps some empowerment to stand firm in what you know to be your values, as well as the contribution that you're offering to the team. Peer support work is incredibly important, and it should be valued at the same level, if not more, which is debatable to certain people, as the clinician's contribution.
Can I come in there very quickly? Just because in my experience, there really is quite a lot of still sort of judgment and a bit of stigma when it comes to peer support versus the rest of the clinical team. So by background, I'm an occupational therapist, so I can, and I'm a peer, and sort of I've got my own lived experience. And in a sense, when I introduce myself as an OT, I get more respect than, or sort of more kind of nods or people waiting for me to say something at meetings than if I am there as a peer. I can really see, for example, a tension in the way we use language. For example, as peer support workers, we want to try and move away from medical type of language and the lingo that is the lingo of the medical profession, so of the clinicians. But we work with clinicians, and so therefore we need to speak a common language. And so we've had problems in terms of, when you're writing your clinical notes after having worked with one of our service users, do you use the lingo or do you not use the lingo? And if you don't use the lingo, is that a good thing or is that a bad thing? So there's so many different sort of little things that play out on a daily basis. But yeah, I do think it is a matter of sort of changing this culture and this idea that doctors know best. So when in the literature you mentioned that, something is about knowing your place, that really sort of makes me cringe and makes me say, oh, what do you mean know your place? That sounds very medical model, as opposed to actually we're here to change that model. But yeah, that's my penny's worth of thoughts. Yeah.
Right, exactly. Thank you for sharing that.